Steve is a 23-year-old accountant and comes to the clinic because he feels strange about feeling unmotivated. He said even eating feels like a chore. He confirmed not taking a bath for 3 days straight because the water feels like needles on his skin. At work, he verbalizes that someone is whispering at him and this causes him to lose his concentration. He is convinced his coworkers envy him so much that they are planning to take him down. Description: despite it being one of the most common psychiatric disorders, schizophrenia is usually misunderstood. Here is how it is described and defined. Schizophrenia refers to a group of severe, disabling psychiatric disorders marked by withdrawal from reality, illogical thinking, possible delusions and hallucinations, and emotional, behavioral, or intellectual disturbance. These disturbances last for at least 6 months. The level of functioning in work, interpersonal relationship, and self-care are markedly below the level since the onset of symptoms. Have difficulty distinguishing reality from fantasy. Their speech and behavior may frighten or mystify those around them. Incidence is schizophrenia occurs in all societies without regard to class, color, and culture. It affects 1.1% of the population above age 18, which is estimated to be 51 million people worldwide. In the United States alone, 2 million Americans each year are affected, with 7.2 in 1,000 persons developing it during their lifetime. Affects both men, late teens or early 20s, and women, mid-20s to early 30s. Equally prevalence is higher than meters in diabetes mellitus, Alzheimer's disease, and multiple sclerosis. Causes: like many diseases, schizophrenia is linked to various factors. Precise causes unknown. There is currently no way to predict who will develop the disease. Genetic factors. It is believed that multiple genes, strongest evidence points to chromosomes 13 and 6, are involved in predisposition to schizophrenia. Other factors like prenatal infections, perinatal complications, and environmental stressors are also being studied. The manner of transmission of genetic predisposition is not clearly understood. Biochemical factors. Involves dopamine, focus of most studies, serotonin, norepinephrine, and epinephrine. Excessive dopamine activity is linked to hallucinations, agitation, and delusion. High norepinephrine is linked to positive symptoms of schizophrenia. Other factors include structural brain abnormalities, e.g., enlarged ventricles, developmental, e.g., faulty neuronal connections, and other possible causes, e.g., maternal influenza during second trimester of pregnancy, epilepsy of the temporal lobe, head injury, etc. Signs and symptoms, behaviors and functional deficiencies seen in schizophrenia vary widely among patients. Signs and symptoms are divided into 3 clusters: positive, negative, and cognitive symptoms. Positive symptoms are associated with temporal lobe abnormalities. Negative symptoms are associated with frontal cortex and ventricular abnormalities. Positive symptoms, deviant symptoms. These are symptoms that are present but should be absent. They indicate that patient has lost touch with reality. Primarily include delusions and hallucinations. Hallucinations are the most common feature of schizophrenia. These involve hearing, seeing, smelling, tasting, and feeling touched by things in the absence of stimuli. An example is hearing voices that command the patient to do certain things, usually abusive and self-destructive. Delusions are fixed, false beliefs. They cannot be changed by logic or persuasion. An example is a patient believing that people can read his mind. Several categories of delusions include persecutory delusions. Patient thinks he is being tormented, followed, tricked, or spied on. Reference delusions. Patient thinks that passages in books, music, TV shows, and other sources are directed at him. Delusions of thought withdrawal, thought insertion. Patient believes others can read his mind, his thoughts are being transmitted to others, or outside forces are imposing their thoughts or impulses on him. Negative symptoms, deficit symptoms. These symptoms reflect the absence of normal characteristics. Apathy is lack of interest in people, things, and activities. Anhedonia is diminished capacity to feel pleasure. Blunted affect is characterized by patient's face appearing immobile and inexpressive. This is the flattening of emotions and becomes more pronounced as the disease progresses. Poverty of speech is a speech that is brief and lacks content. Cognitive symptoms reflect the patient's abnormal thinking, poor decision-making skills, poor problem-solving skills, and ability to communicate, and his strange behavior. The disorder is characterized by confused thinking and speech, e.g., incoherent ramblings, loose association, word salad, wandering. Bizarre behavior include childlike silliness, laughing or giggling, agitation, inappropriate appearance, hygiene, and conduct. Phases of schizophrenia. Schizophrenia usually progresses through three distinct phases. Prodromal phase occurs before hospitalization or within the year.